to do anything. Hello! Awesome. Is it live?
Yep, we're all good.
Yay! Okay, so we're just gonna wait. For those of you joining us on live, we're gonna be probably about 5 minutes more. But today we're gonna be talking about menopause and vaginal atrophy. So join in, and I don't know, how are you guys doing? Just go ahead and comment. I'd love to say hi.
I'll read it out, so if you comment, I'll
yes,
say what's
please. But yeah, we're just going to basically be live, and we're going to give people about 5 minutes to trickle in. But yes, very exciting. I'm excited. I love lives.
Awesome.
Hey, I got a question. Are we connecting on Instagram Live as well?
Yes.
I'm on IG right now.
Yeah, so if you go to, you're on the Instagram right now?
I am, yeah.
Would you go to her Instagram page?
Oh my god.
Just take
I go to, so do I...
If you want to just handle dogs, that's fine.
So if you go to her Instagram page and then click on her live.
I thought we had to invite them. Hello!
So,
oh my gosh! We have people saying hi.
Hey!
We got DeShannon. Hello. Young Draco Shooter.
Okay, I'm on your page. I'm on the Vaginacologist Instagram.
Irma says, "Hi, Dr. Irwin, you're awesome."
Hola, Irma, ¿cómo estás? You are too.
And you request to be in the live video. Am I sending a request to be in live video?
Yep. And just sent you the request.
It should show up in like where the likes are normally. Sorry,
We're
guys.
good. We're good.
Working out some.
Awesome.
Things.
There we go.
Hey.
I will turn off my audio on Instagram just in case.
I love that I can hear you from 2 different devices, Derek.
Is there going to be feedback? I was actually a little worried about that.
Not really. We turn the volume way down. As long as we keep the volumes down, we'll be good.
Okay.
Anybody else saying hi?
No one yet. People are a good number of people are joining.
Yay! Hello! Welcome everybody. We're very
I have you in none of the. There we go.
I'm here.
Yay! Hello.
Hi.
Shepherd family says hello.
Hello. Welcome.
Teresa says hello on TikTok.
Hey yo. I love that. It was very exciting.
Oops.
Happy World Menopause
muted you
Month.
by accident, Dr. Irwin.
Okay.
Oh, you're back. Okay, good.
Yeah. All right.
So exciting. We should be starting in about 2 to 3 minutes. We are honoring World Menopause Month, so we're going to talk all about menopause, vaginal atrophy, so much good stuff planned. So thank y'all for joining.
And there's stuff that actually doesn't necessarily apply just to menopause.
Yeah, oh my gosh. We are live on Zoom right now with Utiva, and they actually are co-hosting this event, and they got so many question submissions from you guys that we're so excited. We are going to be tracking all of the questions that y'all submit in the chat, all the questions you submitted beforehand. And we're going to kind of answer as we go, but also save a lot of the questions for the end. So,
Lindsay Solis says, "Hey, Dr. Irwin."
Hey.
I love lives. It's so much fun.
It really is. It's a winner.
Okay.
That's number 3.
I'm going to go over here to my background disc.
You're doing great, Mom.
Just making sure I got all of it.
You guys are pros at doing this.
They are. I just sit here.
Yeah, I don't know
That's
if
not
you
true.
know, but we've done one other live before, so
We've done multiple lives at this point.
Two.
So I figured,
Terry, this is our second.
No, this is our third.
Yeah.
Yes, it is our third. So we really are pros.
so guys, it is just after 6:30, so I figure maybe a couple more minutes and then I can kick it off and introduce Dr. Irwin and also just a couple housekeeping points.
Sounds good.
Sounds good.
Actually, this is our fourth.
There's no image for Dr. Irwin.
Yeah, I'll put it up in just a minute.
Yeah, this is our fourth one we did. Two for
Is it your
the
video
best you.
that's not on?
No.
Oh yeah. Let's get a video on.
Hello.
People want to watch you work, man.
Here's Dr. Irwin.
This is exciting.
No, we need
Love
two
it.
for best you. Then we did one
No, we
at our
only did one
place.
best you.
No, we did
that's
two
right.
for best you.
Hello. Oh my gosh.
Then we did one for our
You're
place.
right.
And then this is four.
You've been taking your fish oil.
Only when
Memory.
when Taylor
I love
tells
it
me
when
to.
people have their pictures up. Hi, Helen. It's good to see you.
Quick drink and I'll be right back.
I love it. Okay. Let's see.
So everyone, thanks for joining. We'll give it a couple more minutes and we'll get started.
So,
Yeah, and if y'all have any questions, make sure to go ahead and put them in the chat. We'll be logging them. So if there's a topic you really want covered or a specific question, go ahead and type it out and we'll make sure to answer it at the end.
I have you shoulders down.
Me, shoulders down. Do I come forward? Back?
Yeah, well, yeah, down works, yeah.
We've got about 3 cameras in here, so we're trying to figure out the angles of everything. But you can come over. I'm not the star of the show.
yeah, Derek.
Great. I'm just introducing you.
Hey. No, you're. I mean, it's one of the co-founders of Utiva. That's pretty big.
Thanks,
Also,
Dr.
you
Irwin.
thought of
Yeah.
this idea.
I know.
So-
We would not be talking to you without Derek and Utiva. So.
Oh, it's a great partnership that we'll have to keep going on.
Absolutely.
See.
So what do you guys think? I think we should probably get started. Either way, we have about almost 40 people joined on the Zoom, and we can let people in as they come.
Perfect.
All right. Well, everyone, we're streaming live, I think, on Instagram, TikTok, and Zoom. My name's Derek. I'm one of the founders of Utiva Health, a healthcare company focused on UTI prevention and urinary tract health. We are glad that you could join us for the talk tonight with Dr. Teresa Irwin, aka the vaginacologist. Just a couple quick housekeeping notes. We're keeping everyone on mute. All videos are off just so that we can ensure the smooth flow of the presentation. As mentioned earlier, if you have any questions you'd like to ask Dr. Irwin, please add them into the chat box. We will track them and try to address most questions, as many questions as possible. We do have a lot of questions that were already prearranged by everyone who registered. And if you have not yet, please take the time to register at the links that are being sent into the chat box so we can provide you with a special offer at the end of the show as well. So without further ado, I'm going to introduce Dr. Teresa Irwin here. She is a board-certified female pelvic medicine and reconstructive surgery, aka urogynecologist, and the only one between San Antonio and Austin, Texas. She has also been voted one of the best Texas doctors and was featured as one of their super doctors as well. Dr. Irwin provides women of all ages essential education, female empowerment, advanced pelvic medicine, reconstructive surgery of the pelvic floor, and gynecologic aesthetic surgery as well. Dr. Irwin has recently also launched a master course, which we will touch on a bit later on. And without further ado, here's Dr. Irwin to do our talk on menopause and vaginal atrophy.
All right. Thank you, Derek, and Faraz and all of your lovely crew. It's been really great getting to talk to you, meet you, and of course, getting to benefit my patients from the product that y'all have created. It's something that I was using before I ever met Derek, so I know it works. Anyway, today I'm going to be talking about menopause and atrophy. And, you know, menopause, you would think, well, that's going to isolate a lot of people because, first of all, it isolates about half the population maybe a little bit less now because of men, but guess what? They go through andropause and they have a lot of the same symptoms. And then a lot of younger women. But the thing is, in 2015, menopausal women or women without periods surpassed the number of premenopausal women. So there's more of us and we're getting bigger and bigger. So anyway, much of our life is going to be spent in this time range. So I want to give you a little history because I think it's important to understand kind of where we're at now and how we got here. I won't spend too much time on that because I know that the majority of the talk is going to be on mostly question and answers. And I just want to preface it by saying thank you so much for all of those questions. Wow, that was pretty amazing. I have not gotten through all of them, but I will tell you that because there's so many, over 100, I won't be able to get to all of them, but I'm going to cover the majority or the ones that were most commonly asked, and maybe we can do something in the future to get more addressed, or maybe I'll do a video or something of that nature, but I will get to them at some point. It may not be on this particular live. Okay, so I want to start out, like I said, with the history, and you know, I don't think we're going to be able to share screens with everyone, but there are some slides that I wanted to show because I found it very fascinating, which I already knew a lot of this history, but I just wanted to get all the specifics as I was researching it. So menopause has really not been something that's been a known condition or what they call a disease, which is not a disease, but that's how it was thought of. And that was, I'm going to go ahead and share my screen. The Egyptians back in the, 1300s, no, I'm sorry, in 1900 BC, the Egyptians actually, because they termed the word, the uterus is actually called hystera, and they ended up calling menopause hysteria. And it's quite interesting because they would use special herbs and have women take certain, either smell them or take them orally, and then they felt that back in the pelvis. And they would also put it on the vulva just because they thought that they were acting hysterically or weird, strange, obnoxious, and they felt it was because their uterus was in the wrong place. So that's how they would treat it. But anyway, on this slide, which I don't know, I'm just going to show you because what came to be the very first book on menopause was in the 1800s by a British physician, by Edward Tilt. And it was, let me show the screen for those that are on Zoom. And that way we can get that on there. Okay. And I'll get that sharing. Okay, do you see that, Derek? Because I know not everyone's going to be able to see.
It's still your camera right now. Oh, it flashed. There you go.
Okay.
You're up.
Okay. So anyway, this is the title of the book here. On diseases of women in relation to morbid menstruation, sterility, pelvic tumors, and affections of the womb. And he calls the elements of health and principles of female hygiene. And it's interesting because he came up with 143 different symptoms that women had in menopause. And I'm going to point some of those out here. So one of them is temporary deafness, which can be induced or aggravated. Hysterical aphonia, in other words, they can't talk, they stop talking. Maybe women were doing that purposely to their husbands. And then intensely hot hands, erectile tumor of the urinary meatus, that's the opening to the urethra, falling off of the nails, and hysterical state, debility, intense and long continued debility, insanity, intense hysterical flatulence. You gotta love that one. So they felt that that was part of the syndrome as well. Puffed face and foils on their face, labia that's inflamed, and prolapse and incontinence. So anyway, those were all the slides I wanted to show. what another interesting fact in the past was that they were trying to treat women's hysteria, their disease state, and they found that the best way to do it is by inducing orgasms. So back in 1653, the psychologists there used to take these crazy large machines, sex machines, to induce orgasms at their offices in married women to stimulate orgasm. And I wish everyone could see this picture, but because it's crazy. If we think that some of the toys that are out nowadays are intense, this one far surpasses it. So it's this very large vibrator. And at that time, when they discovered that the orgasms were making women happier, they designed at that point hand vibrators that were being then marketed. Okay, so that's it on history. So anyway, in terms of menopause, what is it? So first of all, it is when a woman stops having a period for an entire year. And it can't be the irregular period where you're having a period and then 3 months later you have another one. It has to be literally a full year of no period. And at that point, it's considered postmenopause. The telltale sign is that. Now, the most common symptom that women will have is the hot flash. That is by far the most common of anything. It occurs in about 80% of women. And the average age of menopause is 51.5 in the United States. Now, it can change. It can be altered by genetics or smoking. Smoking tends to make menopause occur a little bit earlier. Other symptoms are going to be vaginal dryness, sleep disturbances, and depression that can be new onset even if you didn't have a history of it, as well as joint pain and memory loss. And that memory loss, I found it interesting one time on Oprah's show. She was naming all the different symptoms that women would have in menopause, and one of them was loss of nouns. Because, their inability to say, okay, can you go get me that, that round thing that's green? And, they would give all the adjectives, but no nouns. She was making fun of how that happened to her mom than her. Anyway, so hot flashes. Many times women think that a hot flash is that just feeling hot, and so it's very important to differentiate because a lot of us feel hot. But it's not just that. It's literally a sudden sensation of heat that starts from the chest and goes up to the face, and then it spreads along the body. And that can occur several times in an hour or just a couple times a day. It can also be associated with intense perspiration, and it's very common at night, but it can happen all day long too. And that can persist. So in a lot of women, it can be a temporary period of time, a year or two. In others, it can last up to 20 years, so it can last a long time. In terms of other symptoms are sleep disturbances. At least 30 to 40% of women will have problems with sleep, at least in the early part of menopause. And depression. Depression is actually a lot more significant than we had thought initially. New onset, so if they never had an episode of depression, the risk is 30%. And if they've had it before, it goes up to 60%. So it's a lot, it's quite a difference. And mood disorders, that's often known in menopause, which is probably where they came up with the hysteria name, in that women's moods fluctuate from being irritable to then crying the next moment and anxious the next moment, which is, again, a hormonal fluctuation. In terms of sexual function, with the loss of estrogen or a dramatic reduction, there's going to be decreased blood flow. There's going to be decreased collagen in the vagina and in the vulva. The cervix will also atrophy, where it can actually become flush with the vagina. And the wall of the vagina becomes less elastic. It can shorten, it can become narrow, pale, weak, thin. Can I add any more adjectives? See, I know all the adjectives. Anyway, continuing sexual activity may improve changes, for example, in size and shape, even if they're not on hormone therapy. But they need to be sexually active regularly. Now, other things I mentioned, memory issues, and the decline there, the cognitive changes that happen are very much estrogen related. A lot of biological evidence is present to indicate that. And that risk is going to go up if the woman also has depression and anxiety. Joint pain. You wouldn't think that that was part of menopause, but it is. 50 to 60% of women will have it. And if they're obese, in other words, their body mass index is above 30, or they're depressed, then that risk is even greater. What's the treatment? So I'm kind of doing a brief discussion so that we can kind of get to the crux of it. The treatment for, in particular, vaginal atrophy, this is what it's all about for today, is first of all, conservative measures. So you start out with vaginal moisturizers, and those are not intended to be used during sex. These are to be used regularly, at least 2 to 3 times a week, to keep it moist. And that can be things such as Replens or Vagisil or Feminies, and KY liquid beads. Lubricants, though, on the other hand, are used for sex. And so that's when they should be applied. And there are different bases. There's water-based, which includes things such as Astroglide. Slippery stuff, I think, is a very good one. And KY. Silicone-based include Paydur and ID Millennium. And then oil-based can be Elegance Women's Lubricant, or just natural lubricants. You can go in your cupboard and get some coconut oil or avocado oil, almond oil. Just keep in mind that oil-based lubricants, so if you're still premenopausal, you can get pregnant, they can break down latex condoms. So you want to be careful with that. Or also it can be messy, so make sure you have towels so you don't stain your sheets. Okay. So anyway, in terms of the use of vaginal moisturizers and lubricants, they can be effective alone for vaginal dryness and pain during sex in patients. But really the most effective treatment is going to be vaginal estrogen. And there are some other hormones that are not estrogen, which include DHEA, testosterone, and something called ospemifene, which is what's called selective estrogen receptor modulator, and it works similar to estrogen in that it thickens the vaginal skin. They're kept less commonly used, and they tend to be a little less effective, and they're still hormones. Okay. Now, vaginal estrogen, the benefits in that is that even just a low dose, because you don't need much, can be effective, especially if it's moderate to severe issues with atrophy, and especially if they're not responding to non-hormonal issues. The way that it works is that it will increase the collagen production. Collagen then stimulates more thickening in the skin, makes it healthier. It allows for the pH to be in the normal range for the vagina, which is acidic, and keeps the good bacteria in there because it provides the substrates or the food for the good bacteria. The lactobacilli is the good bacteria. So it increases secretions and blood flow. Also, it also has benefits on the urethra and the entry to the bladder. There are estrogen receptors there. And therefore, when the reduction in estrogen occurs, then there's more thinning, more propensity for little micro tears there. And that's why bacteria can get in there much more readily and lead to infections. And also, women will have more overactive symptoms, overactive bladder. That means feeling the urgency and frequency that happens more than it should happen without having bladder infection. So normal urination during the day is 4 to 7 times, and at night it's 0 to 1 time. So above that, then it's considered abnormal. But that helps with improving those types of symptoms. So let's talk about estrogen specifically in terms of risks, because this is a huge concern for women. They come in and the moment I mentioned that would be an option, it's like I told them a 4-letter word. But the thing is, with estrogen, when it's given as a vaginal source, very little is getting absorbed in the systemic system. In other words, in your blood. Most of it's actually absorbed there. And the amount that's being used is very low dose. It's only used a couple times a week after the initial 2 weeks. So the risk for blood clots and strokes, heart attacks, breast cancer are super low. It's not 0, but it's very close. But let's say you're someone who can't go on hormones. Then I would definitely refer patients to a pelvic floor therapist so that she can work with you on a combination of things. It could be relaxation techniques. how to improve blood flow through techniques that they will provide, as well as vaginal dilators. Vaginal dilators actually are very effective for women that start to have length and diameter issues because of atrophy. And it's really important to go to someone who can teach you how to do it correctly in order for you to actually have the best outcome without harming yourself. So now, this is not to say that, you know, estrogen is the end all and be all. It's just the most effective treatment that we have that's been studied at this point in time. But it doesn't mean that the others don't work. Now, part of the loss of estrogen in menopause is that you tend to be more prone to UTIs. I mentioned that. So how do we prevent UTIs? Because they're so common, and it's not just in menopause, it's all ages. And all ages tend to get them repetitively. So the first key, though, is prevention. And that's going to be wiping appropriately or properly. That means wiping front to back, from the urethra to just right before the anal opening, and because that will decrease the amount of bacteria that comes from the anus and into the urinary tract. You want to pee after sex, because with the thrusting in and out vaginal penile sex, the bacteria can be travel in much more readily into the urethra. And if you go to the bathroom or pee right away, that tends to flush some of that out. Also, pee in the proper position. Most of us are taught to sit up on the toilet and pee very prim properly, but that's not correct. You're not going to empty correctly, or I should say fully, when you're sitting upright. And I love to use the analogy, if you take a glass and you have a bottle of water and you pour water into the glass, but if you only pour it partially, then you're not going to empty it fully, so you got to turn it, you know, all the way and empty it fully that way, which means there are different positions, and I'm just going to show you one real quick. Is just basically bending all the way forward with your knees right above your knee, with your elbows right above your kneecaps. Your feet are flat, and by doing that from the start of peeing, you will empty your bladder much more readily. So it's very important to do, because if urine remains in there, then that risk for UTIs and a bunch of other issues can happen. And there's 4 other ways to pee. So hopefully, Derek, you're going to share some of our social media handles. You guys can get on to watch some of the videos on that. Also, take your time. Take your time to pee. Take a whole minute. And when we posted one of our videos that said that, one of the responses was like, it only takes 3 seconds to pee. What am I going to do the rest of the time? But you really should. It doesn't have to be right away, but don't rush it. Not just because you have a slow stream or anything of that nature. It's because when you put a lot of stress and strain on the urinary tract, that causes more risk of developing other issues, such as incontinence. That means uncontrollable leakage of urine, or prolapses, when things are starting to drop or sag in the vagina. And then if you're overweight or obese, then losing weight would be important. But more importantly, not so much for the weight itself, but if there's a lot of extra skin in the vulva, because it traps the moisture from urine and such, and that can lead to more infection. Reduce your simple carbohydrates. And by simple, I mean, you know, white sugar, essentially. Breads, pastas, crackers, cookies, tortillas, chips. But don't reduce the complex carbohydrates. Vegetables and fruits, those are complex carbohydrates. And the reason you want to reduce simple sugars is because it increases the likelihood of bladder infections, because guess what? Bacteria love sugar. So, and if you are diabetic, just try to keep your sugars under control. Not only for bladder infections, but also because diabetics are more prone to getting incontinence issues later in life, or early in life sometimes. And drink lots of water. Now, there's not scientific data that says you have to have 8-ounce glasses of water a day, 64 ounces. But if you drink more water and there is bacteria, you're going to dilute it out. So when you get a bladder infection, you have to have a certain number of bacteria in there for it to cause symptoms or a problem. And if you do have some, if you can dilute it out by drinking more, then your risk of actually developing one is going to go down. But as a general rule, you know, listen to your body. If your urine is cloudy or it stinks or it's strong, you need to drink more. Or if you get thirsty, drink more water. Okay. Also, be careful with bidets. Bidets are great, but you have to use them properly. There are a number of studies that have shown an infection occurs as a result of bidets because it was not used properly. The water was sprayed from the back to the front. So then I have patients that will come in and they have poop bacteria in their urine because of that very fact. So make sure that you have the spray so it's going from the front to the back. Now, in terms of the other supplements that are important are going to be probiotics. Probiotics are important because they are living microorganisms and they're the good bacteria, and they line our gut. So foods and supplements will help repopulate those good bacteria so that it can outnumber the bad bacteria. There's lots of different foods that have it: yogurt, cottage cheese, cheddar cheese, sauerkraut, kombucha, pickled vegetables, kimchi, and some others. Now, the one that people don't talk about a lot is prebiotics. And the reason that those are important is because they're undigested carbohydrates. And they're important because the bacteria, the good bacteria in the gut, likes to eat those. It allows for them to populate a little bit more. So some of the foods that have it are going to be onions, garlic, soybeans, honey, banana fiber, which is great for constipation. Now, I mentioned earlier that women get recurrent UTIs. So it actually is more common than you think. And the reason that women are prone is because their urethra is really short, 3 to 4 centimeters, while men, their urethra is 20 centimeters long. So for the bacteria to get into the bladder, it's just a hop, skip, and a jump. Versus for men, they have a 1,600% increase in the distance that they have to travel to get into the bladder from the urethra. You guys, this is why my husband always tells me he's glad he's a man. Anyway, now one thing to do is if you start seeing that you're having recurrent UTIs, you want to look at the pattern. Is there a pattern, for example? Does it happen after you work out and you leave your sweaty clothes on for a while, or your swimsuit for a while, or after sex? So determine a pattern if you can. That way you know how to address it. Now, there's something called honeymoon cystitis, and the reason it was called is that because women would get bladder infections on their honeymoon because they're having more sex. We already talked about peeing right after intercourse. And sometimes you can't, no matter what you do, you're still going to get one after sex. So you can take well, we're going to talk about that shortly here. I think I'll just go ahead and dive into that. So Utiva. For those of you who don't know about Utiva is a concentrated capsule of cranberry at a specific dosing that is medical grade and actually binds to the bacteria to prevent it from attaching to the wall of the bladder. And it has a certain property. It's called anti-adhesion activity. So adhesing towards the bladder wall. And it will decrease your need to take antibiotics if you take it prophylactically on a daily basis. For those, especially that have recurrent bladder infections or during sex. So if you're someone who gets recurrent UTIs and you're taking it daily, then you just take 2 when you have sex. And if you start to have symptoms of a UTI, such as frequency, having the need to pee frequently, or urgency, that constant urge, and burning with urination, then you take 2 on that day as well. The reason that I like Utiva over the counter products, well, first of all, is a lot of them don't have much regulation, and they don't have the studies to show their actual scientifically based activity. So Utiva does. It's been shown to prevent most bacteria that cause bladder infections. And I will tell you, I see so many different bacteria. I mean, in people that are in general GYN or family practice tend to see more of the common one, which is E. coli. And that's what some of the other cranberry pills will take care of, but this one takes care of almost all, which is really great because I've got the difficult ones. But it's becoming more common, and we really want to try to reduce the need for antibiotics because there's so much more resistance happening all the time, and it's getting harder and harder. I'm having to admit people to get them treated for a bladder infection because nothing orally is going to work. So we really want to try to minimize that. And so I'm so glad that this product is out there because I cannot tell you how many patients, even my older patients, are coming back and saying, you know, I'm off antibiotics because they were taking them every day, or I'm not constantly having to take antibiotics in a hospital setting, etc. And in older folks, UTIs can be dangerous because they don't have the usual response. You know, as we get older, our nerves don't work as well as they used to, so we don't feel all the same things that someone who's younger and has more robust nerves. Anyway, the symptoms that they get end up becoming a little late. You know, for example, they start to have changes in their cognition, and at that point, that means that it's already traveled into the blood, and it's certainly much more dangerous.
Dr. Irwin?
Uh-huh.
Sorry, just to take a question from the audience related to your topic about cranberry. A question just came in asking, how does cranberry juice really help with UTIs, whether it's prevention or treatment?
It does not. Most of it is a placebo effect. So, and then you're getting more sugar in there. So you really don't want to do that. Good question though, because that's been commonly used, still commonly used. So you want to reduce the sugars, and you want to take something that works.
Thanks.
And that doesn't. Do you have some more?
Oh, that was just related to the topic you were talking about.
Do you
If
guys
more
have
come
some
up,
that are
we'll
related
ask.
to what I'm talking?
I mean, I guess so like, how is the cranberry supplement different from the cranberry juice? Is it just the sugar that's in it, or?
Actually, there's a lot, but I'm going to defer that to Derek here.
So you know what, and you hit it bang on just now as well, Dr. Irwin. So the juice is really most cranberry juice has very low active molecules inside there, and they're very high in sugar. That's just common. All cranberry products have active molecules. The way Utiva is made is that it's a concentration of the actual active molecules. So we provide 36 milligrams a day of the active molecule from the cranberry with very little sugar, and that's the big difference. You're getting what you need without any harmful side effects.
Okay, and we had another question from the audience. Someone said, so how can I get Utiva if I don't have a pharmacy near me?
Sorry, go ahead.
Yeah, it's not by prescription, but a lot of people don't know about it. And there's two ways to get it. You can get it through the company directly or through Amazon, but it's going to cost you more going through Amazon initially. So they are wonderful at Utiva. My patients have been really pleased with their service. Thanks, Derek, by the way, and Roz.
Yes, that's great. You can get it.
And they can drop ship it to you. Yeah.
Yes, we deliver within a couple days.
CC.
Okay, so we had a couple questions about like recurrent UTIs. So how do you help that? What do you do for recurrent UTIs? How often should you take Utiva? Just kind of a little bit about that.
Sure. So first of all, it's super important that it's truly a recurrent UTI, because I have patients coming to me that are referred for, that's their problem with recurrent UTIs, and at least half the time it's not. So you really got to make sure that you got the correct diagnosis, and that means you need to get a urine culture, not just a urine analysis. Urine analysis is good because it gives you a peek into is this possibly a problem? Does my symptoms coincide with a bladder infection? But the true diagnosis is not until you actually get the culture. And the culture is going to tell you that you have the number of bacteria that you need that is a bladder infection. Because some will say, you know, and I'll just give you the numbers, like it'll say 10,000 of this particular bacteria, colony, CFUs. or colony forming units. But it's not a bladder infection. It's not a bladder infection until it's 100,000. So not only that, you want to know what that bacteria was, and if it's sensitive to certain antibiotics, because yeah, you can get a prescription for the most common antibiotics that will treat it, but it may not be the right one. So you want to make sure that you're being treated correctly and that it went away. Because there are other things that can cause the symptoms and where you think you have a bladder infection, but it really isn't. And if you want, I can say, do we have any questions that are related to that? Because I can mention what those are.
About bladder infections?
No, in terms of other conditions, but I guess just in terms of recurrency, I mentioned the different things that you can do to prevent recurrent infections, which is all the proper toilet positioning and drinking lots of water and peeing for a full minute, peeing after sex, wiping front to back, careful with bidets, etc. So outside of that, taking, like I mentioned, the Utiva on a daily basis or two with sex and symptoms. Other things that you can do depend on if you're in menopause, because you can also add estrogen if you're a candidate. You don't have any contraindications to it. And like I said, the transvaginal is sufficient to treat the bladder. See, so that can be done. But if you're premenopausal, that's not going to be helpful to you.
And
So.
Dr. Irwin, so
Did he cut out?
I think so.
We lost Derek, guys.
Hey mom, what's the name of the product?
Utiva, Utiva. I think I have.
And you can just search for it on Amazon or at their website, utiva.com. We're going to wait for Derek to come back, but I do have a question from one of you guys. And it's about bladder infections. It says, does drinking a lot of water help reduce bladder infections? I think you covered that a little bit, but maybe just a short answer.
Sure. Yes, it does. And it also depends on the stage that you are in the bladder infection. So if it's an early infection, let's say there's 10,000 bacteria in there, if you drink a lot more water and dilute your urine, then you're more likely to avoid developing an actual UTI. So if you're kind of already in that full-blown, you've got 100,000 in there, you're unlikely to prevent it, but it's still helpful. Because then you can clear it out a little bit faster. Good question.
Yes, yes. Ooh, we have a good question, but I kind of want to wait until Derek's back. So we're going to go right into, here's a good one. How do UTIs develop?
Haha, that is a good question. So we all have bacteria that is good in the bladder system, in the urinary tract system. But when those levels start to grow out of hand, that are the bad bacteria, then that risk is going to go up because the numbers increase. And I've mentioned sex is a risk factor because of the in and out thrusting that pushes bacteria there. Bidets are as well. Other things that I mentioned were diabetes. So if you're more immunocompromised, someone who can't battle infection as well will develop it much more readily than the others. And there are, of course, women that are in menopause have a greater risk of developing bladder infections. And if you've been on, it's important to try to be, like I said, be sure that it is a bladder infection. And then it's not going to be considered a true, that kind of goes back to the recurrency, a true recurrent infection unless you've had 2 in 6 months or 3 in a year. That's sort of the classic description for that. But Derek's back on, so if he can finish what he started.
Oh, hi, Derek.
Totally lost connection there. Good old technology. So all I was saying was it was important, to visit your doctor because you never know if you have recurrent UTIs, you never know if it really is a UTI sometimes, and it's important to check it out. So one of the questions that had come up was, can you elaborate just on a high level what other problems could it be if it was not a recurrent UTI?
Sure. There are several others. One is called interstitial cystitis or painful bladder syndrome, and you'll have the same symptoms of the frequency, needing to pee often, the urgency, so feeling that urge that you've got to go, even if it's only small amounts, But the key, the hallmark symptom is pain. But not pain when you urinate, because a lot of women, when they have UTIs, will complain of burning with urination and then an intense cramp at the end. But this is different. This is pain as the bladder is actually filling up. And that's key. If there's no pain, it's not going to be interstitial cystitis. So that would be one. Another would be something called cystitis cystica. And basically, it's a chronic inflammatory condition that's happening from chronic irritation of the bladder. And it can be due to infection or stones or a tumor. And they've developed these little hernias, these little pockets in there. And so sometimes urine gets trapped in there. But it's not a UTI at the time. It can be a result of having chronic UTIs, but at the time that they're presenting, it's not an acute or recurrent bladder infection. There's another condition called urethral syndrome, and that is, again, the urgency, the frequency, and sometimes some burning with urination. And keep the two separate. So one is pain in the bladder as the bladder fills, and the other one is pain in the urethra where the urine's coming out. So that is a big difference. So with the urethral syndrome is they have the symptoms of a UTI, but you do their urine sampling and there's no bacteria. Many times it's actually due to estrogen loss in the urinary tract. But that is another, and I've treated premenopausal patients just on the urethra. They'll literally place urethral cream right on the urethra only to help mitigate those symptoms. So those are the big ones. Yeah.
I have a question from Chelsea, and she said, "Can I fix a UTI at home? At home, I live remote in Alaska with no healthcare near me."
So once it's gone to a full-blown UTI without antibiotics, typically not. So you really need to catch it early. So doing these preventative things are going to be really critical. Now the best that you can do is all the things that I've already mentioned, and maybe it won't be as bad, but you don't want it to get into your kidneys, because if it stays untreated in the bladder, it will travel up the ureters, which are the tubes that drain the kidneys, and then up to the kidneys, and that's a more serious condition. So do all the things that we talked about, and hopefully you can prevent it, or if you do have some bacteria, prevent it from becoming full-blown. So unfortunately not.
Dr. we have a question here. One of the attendees is a cancer survivor on chemo pills to block hormones, and as a result has extreme dryness to the point where its skin feels like it's tearing. Any advice on what can be done?
Yeah. So in that case, probably the atrophy is pretty significant, but you can start out with the moisturizers and lubricants that I talked about. And then I would recommend seeing a pelvic floor therapist so that you can learn particular massage techniques and the use of vaginal dilators to help with that. And it can't be very effective. You just have to be really, really diligent. I did have one patient who, she had a cancer in the lung that was treated with, and I don't remember the name of the chemo, but her vagina ended up closing completely. Like I literally could put this much of my finger in there, just my fingertip, or the top part of it. And so we did manual massage for a while in the office, and dilators, and we got her to about, I think 6 centimeters, and normal, it's about 9 to 10 centimeters in length. And this is that's the vaginal length. And keep in mind that when a woman is excited and she's producing secretions, it actually lengthens by another 50%. But anyway, we got it lengthened enough so that they could have sex, even though it wasn't full penetration. But for them, that was fine. So you just have to be patient and diligent, and be really consistent. There are women, when they've had, like, for example, they were born with a congenital abnormality where they have a short vagina, and they undergo surgical correction. But if they don't continue the dilators, they are going to have trouble. So you just got to be consistent. Kind of like with everything, I guess, huh?
We had a couple questions, and this is kind of related, but about like dry vaginal tissue and vaginal dryness. So what would you recommend for them?
So
kind of in addition, I guess.
yeah, the lubricators that I mentioned earlier, lubricants. The one that I like the most is slippery stuff. And the reason for that is because it doesn't have alcohol. Alcohol is very drying, and I think most of the KYs have it, so it tends to dry much more readily. But the oils, the natural oils that you can have at home are very good too, as long as you know that they can break down latex condoms and that it can be messy. But and then the other things I mentioned earlier, again, the best one is going to be estrogen. If you don't have a reason that you can't be on it, it really does replenish the skin significantly. So, and again, very low risk.
Do you want to talk about your favorite book too?
Yes. So if there's issues with, for example, libido, so decreased sexual desire is very common in menopause. It's actually very common across all ages for women, especially starting at age 30. Their testosterone drops by 50%. And a lot of it has to do too with not necessarily understanding their body and their sexuality. And my favorite book at this point in time is a book by Sherry Winston. And it is a book that teaches women about their areas that allow for sexual pleasure, because many women don't know it, and neither do men many times. And so it's good for both. It's called Women's Anatomy to Arousal, and you can get on Amazon. So it really is something that I tell women, read it by yourself, or you can get on Audible, listen to it by yourself, and then listen to it with your partner, male or female. And it can truly make, if you can understand your body, you will be able to achieve pleasure more readily. So
Dr. Irwin, question here about Kegels.
yeah.
So just wondering, how do Kegels actually work, and does it help with vaginal atrophy?
So Kegels they can. They won't reverse atrophy. They can make the sensitivity better. So Kegels are, they were coined by Dr. Kegel back in 1948, I think. And he first, that's when it was first described. And he found that was being more, by doing these pelvic floor muscle exercises, it strengthened the vaginal walls so that women had less risk of bladder things such as loss of bladder control, leaking urine or leaking poop, having sagging vaginas where things are dropping, and then also sexual function as well. And what it involves, most of us are taught to do Kegels by pretending to hold your pee. And that's an okay way. It's not as effective. It's much better to do it by holding your poop. So pretend like you're trying to hold your poop and squeeze your anal sphincter, because there's a lot more muscles there. You're going to be increasing the strength of them much more readily, because they account for 70% of the muscle strength there, versus the urethra is only 30%. So, but both are good. It's just important to do them correctly. And if you have to choose only one, then the Kegels with anal sphincter tightening is better.
So we have a question over here from the comments. Do you have any recommendations for pain management per IC?
There's actually a whole lot in terms of what can be used. So there's sort of this progression that we like to start with. But I'll tell you that it is a chronic condition. It's not curable, but you can treat it so that you can reduce or make the symptoms tolerable. And I have several patients that they have their little cocktail that's worked for them, and they're doing great. So initially, I usually start patients on, depending on what it is that bothers them the most. So it sounds like pain is in this particular person that had the question. If it's pain, you start off with some of the antispasmodics. For example, the Peridium, it's like a higher dosing of azo. There's a couple of others. One turns the urine blue, and that one has also been used. Urabel is the name of it for the spasms. So those will help on the spasming. Then you go from there. So if that's not working, then you can go on to have what's called a cystoscopy. That's a little telescope that's placed through the urethra into the bladder. When it's done for treatment purposes, what we do is we actually hyperinflate the bladder, because the theory behind interstitial cystitis is that there are little micro tears in the bladder, and every time the bladder is filling up and the urine runs over those little tears, it hurts, right? So if we can over distend it, get it to tolerate larger volumes, then they're not having to go to the bathroom and have as much pain as often. And that's something that's done repetitively. If there are some lesions that are found in there that are notorious to be found in IC, they can be cauterized or burned. Other things that can be done are little cocktails that have several ingredients that are put into the bladder and left in there for 20-30 minutes. We teach women how to do it themselves so they can manage it if they can at home, or they can come into the office to do it. And those are going to be done, it varies in terms of how often. When we first start a treatment, we usually recommend every week until they get resolution or improvement. Or believe it or not, you can do it up to 5 times a day, depending on how severe the symptoms are. So a lot of my patients tend to have travel as a trigger for interstitial cystitis. So they'll come in and get their little cocktails of the combination of medications that are put into the bladder, and that way they can take it and manage it themselves. There are some others that are, so once we kind of go beyond that, there's medications that I don't recommend at this point, and then there's surgical treatments, but those are, third, fourth line treatments that involves a lot more discussion.
Thanks for that. And Dr. Irwin, to be conscious of time, let's do 2 more questions. I have one more here, and maybe we can take one from the audience from Keith. So this question comes back to UTIs. The question is, there's a lot of people that have incontinence that get UTIs as well.
Yeah.
Do incontinence pads contribute to UTIs?
Very good question. Yes, the simple answer is yes. Because of the constant moisture that's there, so it depends on the individual and how badly incontinent they are. So for example, if they have large amounts of urine leakage and they can't get to the bathroom to change, shortly after that, then they're going to have a greater risk because it's getting trapped there, not only in the pad, and depending on the absorbency, but also on the vulva, on the labia, and then that allows for tracking up back into the urethra and bladder. So yes, that does make them more prone. So you got to be cognizant and try to change it. I have patients that will, like, if it's bad, they wear a diaper and they put a pad inside. That way they just have to switch out the pad. But I try to get the incontinence improved. So get that fixed if you can.
Awesome. Okay. So this lady has prolapse, and she feels like she gets a lot more UTIs since she's begun to prolapse. But she wanted to know if there's anything that she could do for prolapse.
Okay, good. Yeah, prolapse, there's basically 3 ways to treat it. Number 1 is pretty much nothing. Well, I say nothing, but really it's going to be seeing a pelvic floor therapist who's going to teach you how to correctly do your Kegel exercises and a bunch of other things, such as avoiding bladder irritants and some other behavioral changes. The second choice is a pessary. A pessary is a silicone device that is fitted in the office to identify what's going to work best for that patient, and we teach them how to insert it and take it out. And that if the patient can't manage it, can't take this device in and out, and they come 3 months, if they're not sexually active, because you can't have sex with a pessary in place, and we this non-surgery multiple times, usually I should say imbalances exist. Is there in treat that as well, or whether it's incomplete emptying, or what the problem. So we combine it all to determine that surgical route. So, yeah.
All right. Well,
there are some that weren't answered, and we will log them
and find the best way or median to come back and address these questions as well that we had missed. But I do believe that Dr. Irwin covered majority of the topics and the questions through the talk. I want to take this time to thank Dr. Irwin for her time and bringing insight into the topic that many of us may not want to discuss and talk about. So it's great to have you here at the forefront to lead the charge and empower women, and also make sure everyone has a healthy life as best as possible. Just a quick reminder that we will be sending out an email after the talk here to everyone that registered and came in attendance here with a special discount code that Dr. Irwin and Utiva are offering for our products and for Dr. Irwin's master course. And maybe you want to take a minute to quickly talk about your master course that you recently put together, Dr. Irwin.
Sure. So it is a total of 15 lessons that are distributed over the course of 5 weeks. And it covers topics on how to take control of your vagina. In other words, how to keep it from enduring all the problems that we often see, many of which we talked about today. And in these lessons, there's also activities that are fun, that are done to help you also figure out what your specific issues are and what is best for you. And even for people that don't have problems, this is prevention. Prevention is the best medicine. Education is the best preventative medicine. And so it is a lot of education, but a lot of important tips that will help, because when almost over 50% of women have incontinence at some point in their life, that's a lot. And if you can start preventing early on, that's even better. So
well, thanks for that, and very glad that you were able to put that course together. I just want to thank everyone for taking their time to join again, and thank you again, Dr. Irwin, for your time and your expertise.
Thank you. I appreciate it. Adios.
Adios.
Wait, don't end the lives yet. Okay. Quick note to everybody on live: if you haven't registered, if you have not registered for the talk, but you want the discount for Utiva and for Dr. Irwin's master course, go ahead and go to either Dr. Irwin's or Utiva's Instagram, and you can register for it, or just send us a DM, and we'll make sure you get that discount. So, thank you.